Good morning. So as I have a little brain freeze stuff going on, so excuse me for that. So my name is Sheila Willis, and I am one of the navigators with the Beatrice Welters Breast Health and Outreach Navigation Program. In the back, you see the handsome gentleman. His name is Neftali Perez. He's also one of the navigators in the program. We're two of several navigators that will be coming on board to the newly introduced program with NYU. But we're the first two there. So as I said, I'm with the program, Ms. Beatrice Welters, Breast Health, Breast Outreach and Navigation Program. My role in the program is to outreach, navigate, and educate. You'll see some slides. I have a few slides of some things we've done recently. The program is really relatively new in the last few months, so we haven't done a lot of events, but they are ongoing now. But this is a few slides of an event that we did recently at the World Changers Church in the Bronx. So I'm sharing some information with them in this particular slide. So we outreach through by participating in various events in Brooklyn, which will be our target market. This was in the Bronx, but their outreach or their congregation is citywide, and they do have a satellite church in Brooklyn. That's where I was trying to target, but they're not fully functioning yet. So they did ask us to come and make a presentation to them in the Bronx. As I said, a lot of the congregation comes from throughout the city. So we saw fit to be there. So our target market for presentations will typically be to churches at their health fairs and at women's ministry monthly meetings. But on a day like today, which is Saturday, where would we normally or typically find women of color on a Saturday morning? Okay, well, we might venture into the laundromat, but that wasn't the answer. We might venture into a laundromat. Now, you've given us another idea, so thank you for that. But traditionally, women of color are on a Saturday morning as in the beauty salon, right? Yes, right? So you might find us in a beauty salon near you soon. You might even see us make a presentation at a community's physical fitness facility, which is also known as the gym. So I have a slide. We did do a presentation at a fitness event. It wasn't even an event. It was a weekly fitness session that's held in Brooklyn and Bedford-Stuyvesant. So if you don't know about it, it's at the Restoration Plaza twice a week, and it's free. So definitely you might want to check that out. But we will be going into untraditional places to meet women, to try to connect with women. So if you have an event, you can always let us know that you would like us to be. So we're not just looking to be in health fairs. We're not just looking to be here at a hospital setting where we might not ever reach a woman. So we educate women at these events about the importance of early screening and the resources available. During our presentation, you will learn about the risk factors of breast cancer. You will also learn about the resources available for breast cancer screening, diagnosis, and treatment options. After a presentation, we navigate to women that have completed our mammography screening request form. So most of these requests are from women who have not had a mammogram within the last 18 months. Upon the request, we contact that woman and assist them with getting their mammogram. We continue to support her as needed should there be a screening that brings about an unfavorable diagnosis. And further treatment options are required. So if there are further treatment options, if they have an unfavorable diagnosis, we will support them throughout the whole process. Navigation will continue as long as the patient has a need. Navigation might also look like us supporting a woman who has been previously diagnosed with breast cancer, and she's requested information from us, such as where to turn to because she has experienced hair loss and is in need of a wig. Or she might be in need of a bra and prosthesis because she was not a candidate for reconstruction, or she chose not to reconstruct. So if she needed information about where to go for that, we would be able to give her that information, where she can go and get that support. Even in my years, I was prior to coming on board with the program, I was a navigator for American Cancer Society. So in that aspect, I supported women with getting them information that they needed. So even if there was no health coverage, we can support in facilitating getting health coverage. If there's a need, if you have insurance, or maybe there's some things that you might not know about your insurance that is covered under your treatment. So a lot of times, those were some of the things that come up, that women didn't know that they could get a bra and prosthesis that is covered through their insurance. So those are things that we make them aware of. And I know at some point during the presentation, we heard that asking questions. That's the biggest thing to me, is that you should ask any question, and if you don't understand it, you have to ask it 10 times and then ask it 10 times until you understand that it can be broken down to you in a way that you are fully understanding what is being told to you and what is being said. And nutrition was another great big factor in it, so definitely look into nutrition support, because a lot of times we have those questions, but we're afraid to ask those questions. You should not leave out of your doctor's office or clinic without fully understanding every aspect of what your treatment is going to be, or anything that you feel that's questionable to you, to make it easier for you to understand. We will navigate to women about resources available to her to get her needs met. Helping a woman overcome obstacles and challenges is what navigation is about. It can help to ease the sense of hopelessness and not knowing where to turn to first. Most importantly, my role as a navigator is to meet the woman where she is, to assist her in getting her need met, even if that need is just something simple as being a listening ear, and making that woman feel comfortable, safe, and cared about. So that's my role in a nutshell. So thank you for listening.